Good morning, everybody. Good morning, good morning. Welcome. We're just waiting, letting everybody come in and join in the fun on a Wednesday. So welcome, everyone. We are recording this, as you'll probably already get the little button. And if you have any questions, feel free to type them in the chat or ask when Rob takes a moment to pause. We'll give everybody the recording after. If you have any other supervisors or anyone that does the logs that may not be able to be here. And yeah, we'll go from there. So it looks like we got everyone in. Rob, when you're ready.
Sure, great, okay. Well, good morning, everyone. Happy New Year to everybody.
Good morning.
Everybody's safe and healthy out there. I know it's challenging times right now, with the pandemic and everything else, and we certainly here at BBSI, your partners are hoping well thoughts for yourself, your friends, your family, everyone else. Okay, so this will be a very, very condensed version. It'll be like drinking out of a fire hose. So that's why we also have your other risk consultants here, the risk team, Joseph, Laura, for example, you see over there. Joe, can you wave? Great, thank you. Chris Carino. Chris, if you can wave. All right. And also Austin Smith. Okay, and along with those gentlemen, my name is Rob Singh, and we are your risk management support team to help you with all things related to preventing injuries, of course, right? That's the most important thing. We want to protect your most valuable asset, but at the same time, ensuring compliance. And one of the things that involves compliance is every year we deal with this, but OSHA logs. So like I said, this is going to be drinking out of a fire hose. There's going to be a lot of information, but that's why, honestly, you have us four to come back to you afterwards and work with you. This is going to be a summary of your requirements. But again, once you understand the gist of what you have to do, go back to Joe, go back to Chris, go back to Austin and work with them if you need help completing your logs, right? So that's going to be key here. So if you don't have those gentlemen's contact information, please make sure you have it. And then we'll move on. So first and foremost, the OSHA log requirements. A lot of you are here because either you haven't completed it, or you're trying to complete it, or you're in the middle of completing your OSHA log. But some of you might be here and you might not even have to be here. So let's first establish who has to be here. Going back to a little bit of history, back when OSHA first started back in 1970, 1971 or so, the purpose was to ensure employee safety and health, right? To ensure that we had regulations, that we had systems, we had laws, we had practices in place so that employers are keeping employees safe and healthy. But one of the things that people don't realize is that there is, a matter of metrics, right? And Janice, if you can go ahead and pull up the presentation right now, let's talk a little bit about why we do OSHA logs. Okay, you can kind of skip through all that, Janice. We'll go through the once you get to the metrics, right? Just like all of you manage specific metrics in your businesses, right? You manage leads, for example. You manage shrink. You manage production. Well, when OSHA first started coming out with the various regulations and laws to ensure workplace safety and health, we also had to, or OSHA actually had to ensure that employers were managing one of the most important metrics out there, which was injuries. How do you know if you have an injury problem if you're not tracking it? How do you know if you have a near miss problem if you're not tracking it, right? Now, of course, nowadays we have things like XMOD. Nowadays we have things like, your premium dollars and things like that. However, one of the things that we want to ensure is that if you are not tracking your injuries, then You don't know if you have a problem. If you don't have a problem, or if you have a problem, you need to know what the solutions are. Okay. So that's why the OSHA log recordability process, or the OSHA logs themselves, was one of the first things that OSHA implemented. I always say manage the metrics that matter the most. Okay. And if you see on this page here, there's a number of different metrics in the world of safety and risk management, okay, that you can use to ensure a safe workplace, but at the same time, managing cost. Injuries cost money, folks, right? They increase your premium dollars, your insurance cost. They increase your mod rate. For those of you who don't know what mod rates is, basically like a credit score for your workers' comp. And unlike a credit score, where the credit score, the higher the better, well, with XMod, the higher the worse. So for example, if your XMod, the base rate is 1, I'll just go through this real quick. The base rate is 1. You know, that's basically, if you're 1, you're just as good or just as bad as everybody else. But if you're like a 1.10 or 1.5, that means you're 50% worse than everybody else. Okay. So ensuring OSHA logs are in place is a very, very important thing. Okay. Now let's go back to making sure that first and foremost, you actually have to do OSHA logs. So number one, if you've had 10 or less employees throughout the entire year, you're exempt from keeping logs. If at any point you've had 11, if you get to 11, then you actually are now covered to make sure you have to do OSHA logs. So just like, Janice, go back to the right, go back to the slide right before that. Thank you. Yeah, right there.
Okay.
Yeah, exactly. Okay, so it says right here, so once you achieve that 11 count here, as seen in red, you are now obligated. I'm sorry, folks, 1 second. I've got a technical difficulty.
Oops. Oh, thought we lost him. Another risk manager want to go through this page? Austin, maybe? Chris, Joseph?
All right, can you hear me okay, Janice?
Yeah.
So folks, give me 30 seconds, okay? We'll be right back. We have a small technical, this will be 30 seconds. We have a small technical difficulty here.
Yeah, Rob, I'll have Joseph go through this page. Go ahead, Joseph.
All right, so what OSHA is trying to do is just trying to hit the bigger numbers, and the bigger numbers is people that have more employees, more accidents, more exposure to accidents. So they try to make a rule and try to exclude certain companies that the industry is not as dangerous, like say a secretary position versus a carpenter. A big difference. The chances of somebody in an office to get hurt are very low, and of course, anybody in construction, that every day things are changing. The accident exposure is really high. So when they're talking about a real small company, less chances of getting hurt, that's why they brought in this clause that's saying if you have 10 or less. But here's the clause that's kind of we have to pay attention to. It says at any time, and it counts for all employees, office, everybody. If you have more than 10 employees at one time, you need to file, and your company's in the high risk area, you have to produce the OSHA 300 logs. You have to keep up with them. So if you look at your payroll, if any of your payrolls through the year had 11 or more, then make sure that you're putting these together. I've also seen OSHA and a few smaller companies ask for them to have the OSHA 300. And they had 9 employees, but they were high risk, and they wanted to see the OSHA 300, so they had to be created. So who has to fill out the OSHA logs? And I know the presentation is moving a little bit on you guys, but
All right.
no worries. This is who has to fill it out, and it's just the companies that fall into those high risk areas, and also if you have 10 or more employees in those high risk areas. So you need both, then you need to produce the OSHA 300 logs. So if your company falls within that, then make sure that you are producing the OSHA 300 logs. And the other thing I like to add is this is an ongoing document. The OSHA 300 log, when you're having it, it has 7 days for you to fill in that one spot when somebody got hurt. It's the OSHA and the OSHA 300 logs. There's 3 different forms of it: the OSHA 300, the OSHA 300A, and the OSHA 301. So the OSHA 300, are you back, Rob?
Yeah. Okay. So Joe, I heard everything you're saying. We apologize, folks. We have literally it's a small 30-second emergency here at the office. But to Joe's point, one of the things he said was, you know, it's a living, I love what Joe said, it's a living, breathing document. This is not something, folks, you do literally at the end of the year. You have to keep this document alive, ongoing, because as Joe also mentioned, once you are notified of an injury, right, and they fall within the classification of recordability, and we'll talk a little bit about that later, but you've got 7 days. It's a living, breathing document. You're supposed to keep this live, because at any moment, OSHA can show up and they might ask you for the log. Next thing you know, you've got 2-3 days to get it to them. If you don't have this log up to date, you're gonna be out of compliance. This right here, this slide shows you, we talked about the first exemption, which was 10 or less. Keep in mind, if at any point, again, you went to 11 or your operations went to 11, you are obligated to keep a log. The other exemption is this right here. There are certain what we call low hazard industries that don't have to keep logs. So if you fall within any of these industries, then again, you don't have to keep logs. But if you crisscross, let's say you are, I'm looking at this, and you're a medical dental lab, right? But you also have a separate manufacturing piece to that lab. That's a perfect example, right? Number 807 there. Then yes, you are obligated to keep a log for that particular operation, okay? So those are the exemptions. If you have any questions, again, this is a snapshot of the industries, but if you have a question, in fact, we did send out an email of this list in comprehensive detail. So if you do have a question, talk to your risk manager to determine if you are actually exempt. Okay, so what goes on the log? Anything that is work related, right? So when you look at a decision tree, you think about yourself, well, you know, what do I need to put on the log? So the first thing is, did it happen in the workplace? You know, and you actually have to go through a decision tree of determining work relatedness, determining if it's a new case, a recording criteria, and then you have other criteria such as sharps and privacy cases and things like that, which we'll go through in detail a little bit. Next slide, please. Okay, this is an example of how the OSHA log looks. We're actually going to go through a live example here in a little bit and go through an exercise of how to go and complete 4 different type of cases. Next slide. Okay, so here's a decision tree I was talking about, right? So number 1, you know, do you have an employee that had an injury? Yes or no, right? First thing is, well, did it, you know, occur at work? Is it work related? If the person had a flu or the person had a hernia, for example, we see that a lot. Okay, well, did the hernia occur at work while the person was lifting, doing something, or did the hernia occur because of previous, you know, pre-existing condition that the employee had? So you need to make sure, is it related to work? Is it in the work environment? And then secondly, is it a new case? If it's not a new case, what you have to actually do, and again, we'll go through this here a little bit when we complete the log, but if it's an old case, right, you go back to the previous log that the person was on, and then you change information on there. And then you determine, right, if it's recordable. And we'll talk about that, which is recordable. So once you understand something happened at work, it doesn't necessarily mean that you actually have to put it on the log. It's got to be considered recordable, which in essence means medical treatment. If it's a first aid case, and I'll define what first aid means here in a little bit, right? So let's just say, for example, somebody got something in the eye and they went to the doctor. There was no medication given. All they did was they irrigated it, right? That can be considered first aid. It actually does not have to go on the log. Another perfect example of first aid is somebody gets cut, there's a laceration. There's no stitches, no medication provided. And all they did was they, put some steri strips on it, bandages, put some actually glue. You can actually do, the glue sealant. That's actually considered first aid. It does not go on the log because it is not defined as medical treatment. Next slide, please. Okay, so this kind of goes through again a little bit of what you're not required to report. A couple things. Let's just clarify here. Next slide, please. Is, for example, if the person was traveling, is that work related? Yes, it can be, right? So if the person was traveling and they were in the course and scope of performing work-related activities, okay, that can be classified as a work-related injury and have to go on the OSHA log. The other thing is home office. People ask us all the time, if the person gets home at work, if the person gets hurt at home, yes, it can be. But again, this is where you work with us, BBSI. That's why you have these risk managers in place here to help you guide you through these. Just don't go ahead and make a off-the-cuff decision. Talk to your risk manager, discuss it, say, here's a situation. What do you think? And then again, our job is to know the letter of the law. Our job is to go in there and read the regulations and make sure that it falls within the scope of what we call work-relatedness. Okay. So other examples of things, okay, that you have to actually report on the job, irrespective, right, is a death, anything that results in days away from work, like lost time claims, restricted or mod duty claims, medical treatment beyond first aid. Again, I'll discuss what medical treatment means in a second here with another slide. And then loss of consciousness. Anytime somebody loses consciousness at work, that's considered recordable. And then a significant injury diagnosed by a doctor. Yeah. All right, so again, what does medical treatment mean and what does it not mean? Okay, so if technically, most of the time we just tell people, look, if they go to the doctor and they get medical treatment, most of the time it's going to be recordable. But there's a lot of times where, we'll talk to the doctor and says, hey, you know what, this is a pretty minor injury. Is there a chance to potentially consider first aid? And that's what we do a lot for our clients, is we help you try to save you money, on your workers' comp costs and the OSHA logs and things like that, because there's a lot of times where these injuries, if you speak to the doctor, they can go ahead and consider first aid. And that's something that you can do. Again, speak to your risk manager when you have these injuries, and we can probably even help you out with that. But medical treatment is not a visit to a physician that just is for observation only. So a perfect example is we've had situations where our clients have maybe had an employee twist their ankle or something, slip and fall. And it's not really a big injury, but the employee's like, yeah, I want to get checked out. Just want to make sure. So we'll have them go to the doctor, and we'll speak to the doctor and says, hey, doc, you know what? Yeah, the employee wants to check it out. Can we just go ahead and consider this an observation visit at the same time? Can you do X-rays and just make sure you give comfort to the employee? So we actually just request X-rays. We do observations for observation treatment, and next thing you know, it's not a claim, and it's not a OSHA recordable, right? So understanding some of these things, some of these nuances is important, because BBSI, especially if we're involved, we can help you out in terms of not making a claim or not making an OSHA recordable case. Okay. So the other thing I talked about was ensuring that injuries or cases that are first aid are not recordable. And the interesting thing about this is OSHA defines first aid pretty comprehensively. They have an entire list, and this is an example of what that list is. I'm not going to sit there and go through all of them, but using non-prescription medications, the non-prescription strength, basically if it's just like over-the-counter medication that the doctor gives them, hey, ask for that. It's not considered recordable. Administering tetanus shot, it's not considered recordable. Cleaning, flushing, and soaking wounds, just like I talked about the eye situation, that's not considered recordable. Using wound coverages such as Band-Aids, or for example, I talked about steri strips, and glue, is not considered first aid. Hot cold therapy, using braces and things like that. Keep going, Janice, please. All right. And then these are all the different things: drilling, using eye patches, finger guards, massage, drinking fluids, relief free stress. So again, a lot of times what we'll do is sometimes we'll talk to the doctor and say, hey, is there a chance that first aid can be given? Because there's a lot of aggressive first aid treatment that can be given to treat an injury, and it doesn't have to be recordable, or even for that matter, a claim in most cases. Okay. So again, you need to determine work relatedness and recordability there. So we have, again, going back to decision tree. Number one is it, in the work environment? Did it occur at work? Is it work related? Number two, is it first aid? Was there medical treatment, right, provided? For example, they had a laceration and they actually did stitches. At that point, now it's medical treatment. It's going to go in the log. But now, what you're going to do is, as we've taught you many times during our injury management training, right? And we should be doing this, folks, with you, by the way, at least once or twice a year, where we go through injury management process training. This allows us to ensure that you are managing injuries to the most effective methodology possible to, number one, ensure the best care for your employee, but number two, ensure that the claim or the injury, okay, is going in a positive direction, where again, the employee is getting care, but at the same time, though, we're moving towards closure of that claim. There's a very specific methodology. So listen, if you haven't scheduled that with our team yet, the injury management training, right, please do that. Because we talked to you about things like lost days, right? So for example, if you go to the doctor and then the doctor put the employee on lost time, they're going to get a work status report every time they go to the doctor. And that work status report should come back to you immediately, whether the same day they take a picture of it and they send you a snapshot of it on the phone, or the very next day when you meet with them to discuss their injury, to discuss the medical appointment, you're discussing the work status report in detail with them. And that work status report is going to say one of three things, folks. It's going to say that they're on full duty, they can go back to work, they're on mod duty, or they're on lost time, or they could be discharged, right? So once you see that work status report, that's going to help you drive what goes on this OSHA log. And we're going to go through it here in detail, but if you have lost time, you're going to count days after the date of injury. Same thing with restricted. You're going to count the days after the injury. So if the doctor put them on mod duty or restricted duty, you're going to put the person on the log, and then there's columns for, what type of injury it is. Is it a restricted day case? Is it a lost day case? Is it a regular case? And then you're going to start counting how many days of restriction they had, up to 180 days, right? So you always stop at 180 days, irrespective. If they have restrictions for 200 days, which if you have one of those cases, that's a doozy. We want to make sure that we figure out why. But the max count is 180 days. Next slide, please. Okay. Again, this defines restricted cases. Just because they're restricted, they have modifications. There's a lot of other factors. If they're unable to work a full day, that's considered restrictions as well. If they're unable to perform their routine job functions, that's considered restrictions. Okay. And 4 hours is usually considered the cutoff. Okay. We can go on to the next slide, Janice. Okay. Job transfer, same thing. If you have to transfer their job, okay, or assign them another job because of their injury, that is considered recordable, folks. Right? Because the injury affected their ability to do their normal job. As simple as that. So that's considered a recordable case. Okay, next slide, please. Let's talk about privacy cases and bloodborne pathogens. again, you'll see this in the log here, but there's a section on the log where you have a section just for injuries, okay? I hurt my back. I got a strained sprain. That's an injury. I twisted my ankle. That's an injury. All right. I got COVID. That's an illness. All right. I got a bloodborne pathogen case. Basically, I got exposed to a needle. We have a lot of cleaning companies that we work with, right? And a lot of the employees, sometimes they get poked with a needle. And that's considered a bloodborne pathogen case. So there's a section on that, on the log for these type of cases. Now, whenever you have a case such as a bloodborne pathogen case, or whenever you have a case that involves maybe something very, very private, a sexual harassment case, something to do with, the private parts of an individual, okay, something very, very sensitive, you consider that what we call privacy case. Keep in mind that employees have the right to see your logs at any time. So if you have something that's a very sensitive case, what you do, and we'll talk a little bit about this, we'll show you this, you put in privacy case. Instead of employee's name on the log, you actually put in the word privacy case. You list the type of injury, you list all the different parameters, how many days lost, how many days restricted, whatever it is, but you keep the employee's name removed. And then on a separate spreadsheet or what have you, a list, you go ahead and you put a list of those privacy cases. So you put privacy cases, and then you actually put the employees' names. Okay. So keep that in mind. And again, if you have any of those situations, talk to your risk manager, and we'll help you through those. Okay. Next slide, please. Hearing loss cases. Yes, you have to have hearing loss cases. So some of you, if you have what we call a noise control program, where you have, again, I don't want to get too technical, but you have a hearing exposure of 80 decibels over time weighted average of 8 hours. If you have a noise control program, right, talk to your risk manager, because we want to make sure that you are complying with that noise control program. There's a lot of technical things that have to be done there, but ultimately, if somebody had what we call a standard threshold shift of 10 decibels of a loss of hearing, right, because of hearing levels in your workplace, then that's considered recordable as well. Tuberculosis cases, again, pretty much self-set here. If you have somebody that got exposed to TB in the workplace, you have to go ahead and put them on. Okay, so Joe talked about this. The log is a living, breathing document. Right now, you should have a log started for January 1st, right? And every time you have an injury, you've got 7 days to make sure that you put that injury. And that 7 days gives you, the reason why we do 7 days is because it gives you a chance to determine recordability, to determine, hey, is it medical treatment? Is it first aid? Is it an illness? Whatever it is, so it gives you time to determine, if it's actual recordable case. But you have to do the log itself, keep that a living, breathing document. But then you also have a 300-day summary that takes that same data on the actual log. And we'll show you this, that has to be posted from February 1st to April 30th. And that really is, you have the OSHA 300 log itself, which is the case-by-case listings of the individual injuries. And then you have a 300-day summary, which takes those cases and summarizes it into general numbers. So you had 5 injuries throughout the year. You had, out of those 5 injuries, you had 3 of them that were lost day cases. And out of the 5, you had 2 of them that were restricted day cases. And then, calculates how many total days of lost time, how many total days restricted. And then that has to be posted from February 1st to April 30th. You as a company executive or somebody at the workplace company executive has to sign off on it, and they have to keep it there until April 30th. Okay. And this should really go, I would say, where you have all your other safety information. So like your safety, OSHA safety posters, whatever, things like that. That should be something that, that should be the place where you probably want to post it. Okay. Next slide, please. Okay, keep going. And then Janice, let's keep going here. We might as well get to, actually, let's talk about the electronic reporting. Okay. Janice, if you can pull the list from 20 to 250 of employees that are required to electronically report? Thank you. So I'm sure we have also, we're monitoring questions and things like that. So I don't see anything in the chat so far, but Chris, Austin, and Joe, feel free to answer. Let me know when you have it up, Janice. Okay, here we go. Perfect. Now, this is important. And again, you probably saw the email that we sent out, but about 3 years ago, federal instituted a new law stating that employers at 250 or more employees have to electronically report the 300-day summary data. At first, they said you have to report everything on the OSHA log, each individual case, and then they changed it, right? So you actually have to go electronically and submit your OSHA 300-day data. Remember, the 300 days is just a summary. It's not the individual cases, right? Again, before they used to have it where they had to do everything, but no more. So irrespective of if you're at 250 or more employees, okay, or more, you have to do this. The deadline is March 2nd. Okay, and there's a link that we sent you. If you don't have that link, talk to your risk manager, we'll send you that link again. Right, and really all you do is you go in, it's called the information tracking database, or I think whatever the acronym was, I forgot. But the other thing is there's exemptions of this. And the exemption is just exactly what Janice had pulled up here. So if you are between 20 to 250 and you fall within this list, you have to go ahead and do it. Wrong one, Janice. The one you just had up earlier a second ago. So what that list encompasses are things like construction, manufacturing, okay, labs and things like that, right? So ultimately, if you have more than 20 employees, right, from 20 to 250, and you meet that list of those different industries, you are required to go ahead and still do this. If you don't fall within that list, you actually don't have to do it at all. Okay. All right. So Janice, let's go ahead and pull the actual OSHA log itself. You know what, I'll tell you what, I think I can actually take control. Let me do this.
Sorry, I was muted that whole time. You
No.
should be able to share now, Rob,
Yeah.
sorry.
Okay, all good. All good. Okay, can everybody share here?
Down at the bottom, share screen.
All right. Everybody see my screen?
Yep.
Okay. All right, so folks, again, real quick, I want to make sure that this is important. So if you have more than 20 employees and you fall within any of these, you actually have to do the electronic reporting, right? And we sent everybody a link to this as far as how to do it. If you need help, speak to your risk manager, we can walk you through it. But ultimately, all you're doing is fairly easy. You go in there, you create a login, you know, and then You have password and everything else. And then literally what it does, it brings you to a page that looks exactly like your OSHA 300-day summary page. You just put in the data and you submit it. All right. So if you're manufacturing, construction, utilities, your grocery store, department store, okay, charter bus, freight trucking, if you're a trucking company, right here, you have to do it. All right. But again, if you have any questions on it, let us know. We'll help you out. All right. Let's actually go through an OSHA log. Okay. All right. Can everybody see this? Dennis, Chris, Austin, you guys can see it?
Yes, we see it.
Okay. So remember, living, breathing document, you got 7 days. You realize that you do have a case. Okay. And there's different type of cases. We're going to go through different type of scenarios here. So let's say Daffy Duck sprained his ankle. He was coming off some scaffolding, stepped off, and he sprained his ankle. Well, what is the case number? Case number could be 1. It could be a claim number. It could be anything you want, right? So let's just keep it simple. We'll keep it at 1. All right, so we said Daffy Duck got hurt, right? Okay. What's his, he's a scaffold. Scaffolder. Did I spell that right? All right, date of injury. He got hurt, okay, on 1/3. So I don't have to put 2022 because it's assumed, right? This is the 2022 log. So you see over here? Right, in fact, we'll change this to 2022. There you go. Right, you're gonna put your establishment name. Let's just say it's BDSI. Right, city, San Jose. Right, so this is something that you have that we give to all of you. If you don't have it, reach out to us. We'll make sure you have one. You can keep this electronically. You don't actually have to have a printed log, folks. All right, where the event occurred. This doesn't have to be so specific. You don't have to have the exact address. You know, you can just say customer job site if you want to. All right, you know, you're a scaffolding company, you know, and you're working for a GC at a job site. All right, some people they'll put an address, but you know, it's up to you. I've had OSHA inspectors say that just using customer job site is okay. All right, what happened? Again, you don't need to have, you know, a book on this. Keep it simple. They only give you so much space. So, employee was stepping off scaffold, sprained ankle. Okay. So this is where it gets interesting. This is where we get a lot of customers that get confused. This section right here, folks, all right, it's a one-time thing. You either have a death, you either have a case that involves days away, you have a case that involves restriction, or you have a other recordable case. You have to only pick one, but what you do is you pick the worst case scenario. And a perfect example of that is, let's say that Daffy Duck sprained his ankle. He went to the doctor. Again, go back to your injury management training, right? Doctor gave the employee a work status report. Work status report, you got it from the employee. He sent you a picture. He or she sent you a picture. The next day, you got the work status report. You're speaking to the employee about the injury. Now, on the work status report, it actually says, okay, what the restrictions are, what the status is of the employee. Is the employee on full duty? Employee is fine? Is the person on restricted duty, or does the person actually have to be off work? Let's just say in this particular example, right? The employee had restrictions. Stay off the ankle. For more than, do not be on the ankle for more than 4 hours a day. So that's restriction, right? So at that point, what you do is you pick the worst case scenario, which is restriction. You can only pick one, right? And then at that point, you start counting the restrictions. So doctor says, okay, you're going to be on restricted duty until your next visit, which is going to be February 1st. So at that point, you know, hey, at the very least, person's going to be on restriction for about 30 days. So if you want to, you can even put in 30 days there. Now, what type of case is it? Is it an injury? Is it a skin disorder? Is it a respiratory condition? Is it poisoning? Is it hearing loss? Right? It doesn't fall within any of those other 2, 3, 4, 5, or 6s. It's an injury. So check mark injury. Now let's go to another case. Case 2, right? Minnie Mouse. Okay. She's also a scaffolder. Date of injury was 1/5. Right? Customer job site, same thing. Right? And in this situation, she was lifting material, separated shoulder. Now, this is a pretty bad injury, shoulder separation. In this case, the injury was so bad that the doctor put her off work. So which letter would I mark? Right? It would be column what? H, right? So for those who got that, guess what? You want a free presentation from BBSI. Only today, special discount rate, or free, it's not discount rate, what am I talking about? All right, so days away from work, it's a lost time claim. The doctor says, Minnie, you can't work for at least 2 weeks, right, at all. We don't want anything, we don't want you moving. This, you know what, we're gonna cast you up, we're gonna do all these different things, and we don't even want you at a job site. The injury is so bad. So again, you only pick one. But let's just say 2 weeks later, right? The shoulder stabilized, and then the doctor said, okay, Minnie, you've been off for work for 2 weeks, but now I'll put you on my duty for another month. What do I do? Do I also check mark this? Who says yes? Who says no? I can't see the screen here. All right. Whoever says no, again, you win the prize of a free presentation. No. What do you do? Even though the case involved both lost time and restrictions, you put the worst of the scenarios. So I take this off. Everybody see that? The worst of the scenarios. Anything from G to J. But as I said, the case involved days, person lost, which was what, 14? We said 2 weeks, right? So we said 14 here and 30 days restriction. So you still do count both scenarios in terms of days. Okay? And is it a skin disorder? Is it respiratory? Is it poisoning? No, it's an injury. So there you go. Okay? Does everybody see that? All right, let's take one last scenario. All right, and say Bugs Bunny. All right, scaffolder, same thing. Injury occurred on 110. Customer job site. And he was drilling that's what I say, was cutting wood got a laceration. And laceration. Okay, all right, pretty simple, right? So gotta handle that laceration. So in this case, you know, of course, it's not a death. The doctor, he saw the doctor, he or she saw the doctor, and doctor says, okay, hey, yeah, you know what, got a pretty bad cut. Let's do this. Let's go ahead and let me ask you this. If I put steri strips on it, if I just put, you know what, one of those first aid glues on it, would it be a case? No, right? Because that's considered first aid. But if the doctor stitched them up, would that be a case? Yes, because that's medical treatment. So we know that there was medical treatment because there were stitches, but the doctor also put him on full duty. It says, hey, you know, Bugs, you're good. You can go work and things like that. You know what? Clean the wound, keep it, you know, keep the dressing on it, make sure you're changing the dressing, whatever, things like that. You're good to go in about 2 weeks. Come and see me. You know, we'll take the stitches off. You'll be good to go. So no lost time, no restrictions. You know, what you do is here you put other recordable case. Okay, because it wasn't death, it wasn't days, it wasn't a lost time claim, it wasn't restrictions, and it was basically a general case. You don't have any days lost, so you don't put any numbers here, or you don't have, and again, any days restricted, so you don't put any numbers there. And again, same thing here. We have you know, if we have a bloodborne pathogen case, you can put privacy case here, right? And everything else still applies. Okay. So if you see here, what it did, it was a total of numbers, the total of numbers of your cases that were days away from work. The total, this actually should be 1 here. I don't know why it did total. Okay, so this should total here is 1 because you have another case and then you have 1 here. So this should basically come out to like 3. Okay, and then you hit, you know, your log itself will go ahead and calculate all these. It should be calculating, and then all the numbers would total here on the bottom. So now you go to your 300A, and this is the one you actually have to post, right? Okay. So those numbers in the log here should actually transfer over here. Okay, so how many cases do we have? Last time cases, we had 1. We had 1 case that was restricted, dude, and then we actually had 1. There should be 1 here. We had 1 case that was just basically full duty, the laceration. We have the total number of days here, right? And then total number of injuries should actually be 3. Okay, see how this works here? Fill this information out over here, your name, address, okay? And then this is where you actually have to know what your average number of employees were throughout that year, and then your total hours for the employees worked last year. If you need help with that, contact BBSI, contact your payroll person, your risk manager, and we can actually help you out with that. Okay. But again, because it's a living, breathing document, you should be able to have that information at the tip of your fingers. What you do here is you go and sign it, company executive, phone number, title, date it, and post it. This is what you post. This is also what you electronically report. So when you go and you actually click on the link for the federal OSHA electronic database, you will see something like this. Once you have your login information, all those things, and you simply just transfer these numbers here to the electronic database. It's very, very simple, folks. Believe me. It might take you it takes you longer to actually log in and actually create an account than it does to do this information. Okay. All right. A lot of information, right? Like I said, this was like drinking out of a fire hose, but that's why we're here. That's why folks like Janice, your HR consultants, Joseph, you know, Chris, Austin, myself are here. If you need any help filling this out, or if you need any help, you know, determining work relatedness or whether you have a case or don't have a case, let us know. We're here for you. If you need the information to be resent to you in terms of the injury tracking database link, you need one of these OSHA logs, the electronic OSHA logs. You need those forms that show whether or not you're exempt. Again, let us know. We can go ahead and email all that to you. Okay. Janice, Joe, Austin, Chris, anything to add?
Yeah,
Nope.
Rob, a couple of questions regarding the NAICS number, the North American and Industrial Classification. And that's kind of like where OSHA knows where you fall under, or you could also use the SIC number. Some of the people are having a question regarding that. And you can ask us for that. There's one right now, the electricians, I think it's fall under contractors, but well, I'll look it up and I'll send that to, I believe Grant was asking that question. We'll get that out to you guys, but that goes in that section that you have posted right now, where it's underneath your address and the industry that you're in, whatever you're doing. And then you either put the SIC number or the NAICS number.
Just to add to Joseph, though, and to what Rob has covered in today's presentation, OSHA logs have a lot of nuances with it in regards to, every injury is different. So feel free to reach out to us. We're here for you guys to be able to walk you through and provide you with the information that's needed. Do note, one thing to also, I don't think was covered, is that you do need to have 5 years worth of this data in regards to having it available. It's not just the previous year. So make sure that you do have this document, stored.
Yeah, Austin, thank you so much for mentioning that. And as you said that, I also remember something else we didn't cover. COVID cases. So do you have to put in COVID cases on the log? Yes, you do. You put it under an illness section, okay? But again, folks, talk to your risk manager before you do that, right? The laws pertaining to COVID cases are very, very complex. And the bottom line is you have to ensure that that COVID case actually occurred and was in direct relation to the work environment, that the work environment, that person, whoever got COVID, was actually got COVID because, maybe they happened to touch something, they touched a tool that had COVID on it, or somebody was there. It's usually between the 3 and 5 days, the incubation period, right? Where somebody had COVID, they were working, and then somebody else came and they got COVID because they were around that person. So again, don't shoot by the hip here and just say, oh yeah, I got a COVID case. No, talk to us, because there's so many cases out there right now, as you know, of COVID, and a lot of them are unfortunately, they're not industrial related. So just don't go in and say, okay, let's work with it and put it on the log, right? And OSHA does understand that. So talk to us before you think you actually have to put a COVID case on your log. It actually has to be a very, very direct correlation and relation to the work environment. The work environment actually contributed to that person getting COVID. Okay. Chris, Austin, Joe, anything else? Janice, anything?
I wanted to point out one last thing in the log that you guys see in front of you guys right now as well. There is cases where you have people that did lose time of work, and they did also have a restricted of work duty. So you put in an X under both, and then the total number on the under K and L of how many days restricted and how many days off work. So those, you could include those in there as well to get a better picture of the claim.
Well, Joe, 1 second though. Again, we went through this here when we went through the exercise. You don't, everybody should see my screen here, but from G to J, you only put the worst case scenario. If the person had a case and they had lost time and restrictions, so they were off work for 2 weeks and then they were on restrictions for 30 days, you only put the worst case scenario. Just like Minnie Mouse here, right? Minnie Mouse had 2 weeks of lost time and she had 30 days of restriction. You put the worst case scenario, which was a case that involved lost time, which is H. Worst case scenario.
Correct.
Okay, good point though. Okay, folks. We appreciate your partnership. Your risk management team is here to help you with all things related to, ensuring compliance. We offer so many different services. Take advantage of it. Let's make sure we're scheduling injury management training. Okay, let's make sure that we're also scheduling here your visits for 2022. Let's do a gap analysis. Let's make sure that all your programs are in place. Let's make sure that, you know, we're on track with reducing injuries. Every quarter, we should be seeing you at a minimum, ensuring that you're tracking, you know, you're tracking well in terms of injury prevention efforts. You know, all these things, again, it's your most valuable asset. So let's make sure we're going there. We'll help you reduce injuries, prevent injuries, and doing everything we possibly can to ensure you have a best-in-class health and safety management system. Okay, so please reach out to us and let's ensure that we're scheduling your visits here in the next 2-3 months for your first quarter, if not more. Okay, we appreciate everybody and have a great rest of your day.
Have a good one, everyone. Take it easy.
Thank you.
Everyone.